critically appraising medical literature on social media. So why the need? Let me just summarize this in the light of the fact that more and more patients come to us asking if this video is relevant, if this newspaper article is relevant. I think it is only prudent for all of us to be aware of the fact that there are guidelines that help us to appreciate information available on the social media. Just to highlight, the study done in Kanchipuram has shown 86% smartphone users actually they prefer using online information than actually going to a doctor. And 12% of them actually self-medicate themselves without validating what they're looking at. So earlier it was all shifting challenges from finding information. Now it is assessing how credible the information is. And last thing is, now we are at the phase where we are trying to find a framework which can help us critically appraise what is available on social media. So I'll be using the user's guide to the medical literature series on the social media. This is the part 1 to it, how to interpret my healthcare information available on platforms. I just highlighted the Gordon guide for all of us who are aware of critical appraisal skills. He's the man who's authored the guide to the medical literature. It's the JAMA guideline to medical literature. So this was published in BMJ in February 2022. So this four-step approach is basically based on four already predetermined checklists, which were looking at actually qualitative studies, which we look at a different day. So the Discern, LIDA, JAMA benchmark, and Health on Net code of conduct. So at the end of this, in the interest of time, I shall not go through how they had approached it. But at the end of it, they had come to a conclusion on a four-step criteria to appraise all the available information on social media. So that will look at trustworthiness, which we will look at accessibility, usability, privacy, and confidentiality. So a rheumatology resident is looking for a quick reference video summarizing a clinical trial discussing sequential therapy with belimumab following rituximab. So he had gone through a series of videos online that are available on YouTube, and he had finally chosen this. I would have loved to play the video but then in the interest of time, I shall skip that. So did he pick the right video? At the end of it, that is what we are expected to answer from the patient. Is the video right? Can I follow what is being said? So trustworthiness. So because we are all aware of how a CAS checklist works for all other study designs, I try to make it in the form of CAS checklist. This is actually a textual article that is published in the BMJ. So what is the source of the content and our qualifications with the author transparently reported? So the hint is that source identifies name, credentials, affiliation, and other important qualification. So in the video, which I did not show, so the video is posted on a private channel by a practicing rheumatologist. The page does not have a description. He identifies himself by name, but however, he does not mention the qualification. He mentions affiliation with the Leeds University in UK. So this is just a snapshot which I had gotten it from another source. The best would be for him to have mentioned, given his credentials and his affiliations in the introduction when he's starting the video himself. Next, does the author present a comprehensive and up-to-date assessment of the topic? This we have to take into account the light of the disease in context. Let's say the context is consistent with recent literature and complete. If we were to describe a disease, then it has to describe transmission, symptoms, prevention, treatment, epidemiology. In the video, in the context, this man is talking about sequential belimumab followed by rituximab. So in that, he provides broad, non-pointed information on earlier trials, which is how he starts off the video. And he explains the biological reasoning for the usage of belimumab. The red flags there was that this is quote unquote, he says rituximab failed to meet the primary endpoint in the initial pivotal trial of SLE. So I would have wanted him to say which is a trial that he was referring to. He also says used off-label in various other centers with high efficacy rates. But he does not clearly mention the indications he was referring to. Off-label was the word that he used generically. So I did not think there was comprehensive and up-to-date assessment of the topic in the video. Are areas of uncertainty presented? Is there a balanced presentation of the use? So what we're looking at is if it is present if the content is presented in an unbiased manner and acknowledges if the knowledge deficiencies exist. So he did review certain areas of uncertainty, mentions contrasting results from earlier study. However, again, he did not mention the title or the journal or the date of the journal that he was referring to in his introduction. mentions need for a larger study and a clinical endpoint as a primary endpoint. So is content independent of conflicts of interest? It is not influenced by sponsorship advertisement. More often than not, an advertisement on weight loss would be sponsored by protein powder or something of that sort. So he does not mention conflict of interest, but he says he's reporting on behalf of Room Now, which is the channel. But there's no description of the channel. This is all the information that we have from the channel on the YouTube. So it says it's for rheumatologists and musculoskeletal care providers. It does not really mention who is running it, what are all the affiliations to it. Uh, so the next question, the first thing was trustworthiness. The next one is accessibility. This is self-explanatory. So it essentially means if the content is accessible and does not restrict to private users. So it was publicly available without access restrictions and free of cost. However, he does not provide the link to the original article that he was referring to. He just mentioned that the abstract was submitted at the EULA meeting and the abstract number was OP0129. Can the user obtain content from the platform without technical expertise? It was an open access video. There was no technical expertise required. Usability is the third thing. So for information targeting patients, does the information meet health literacy standard for ease of use? So the first part of the guidelines is actually meant for patients. So in the context, if the video is meant for the patient, the content is presented at level 6th grade or lower. So anybody who studied less than 6th grade also should be able to understand what is being referred to in the video. However, here it is meant for practicing rheumatologists. So this question is not applicable because content is meant for rheumatologists as mentioned in the description of the YouTube channel. So for information targeting clinicians, is the information presented without excessive technical or statistical jargon? It was intended for rheumatologists as mentioned in the description. There was no excessive technical or statistical jargon. Does the content have the potential to improve patient care by providing actionable items and supporting the patient-physician relationship? He did provide actionable items in the form that we need to have a larger phase 3 trials with clinical endpoints as the primary endpoint. However, I felt he should have mentioned about discussing the results of the study with eligible patients to make an informed decision about the existence of such a drug. The last thing he was looking at is privacy and confidentiality. The platform does not collect sensitive usage data and personal information such as ethnicity and political views. Users can access these videos anonymously, like I was able to access it without having to disclose any personal information. So at the end of it, I mean, I wish I could have played the video, but he provided a video that satisfied most criteria except for the author's qualification, which was available at other sites. He should have elaborated on the trials that have earlier studied rituximab instead of giving a generic term saying in the earlier studies. He should have included some information for the patients. Ultimately, it is all boiling down to patient care. So did he pick the right video? I would have given a 7. So thank you. So for those who are interested, the second part is actually how to appraise studies using data from these platforms. That is also written by Gordon Guyot and co. Thank you.